This video is going to be a little bit different than my normal routine of videos where I always try to find something positive to talk about. This one, the subject matter really isn't very positive. I'm not really sure where to start, but I guess I'll take you back to the beginning. And it was several months ago, I had this little spot on the top of my head. It was like a little scab, which I guess I'll show you a video of what it looks like today, just so you have context and you know what I'm talking about. I'm going to have my assistant help me here and show you what this looks like on the top of my head. So if you want to zoom in there, and you can get a good idea of how it looks. Can you see it on there? Mm-hmm. Alright, so that's what it looks like. So this little scab wouldn't go away, and I would pick out a little bit, and it stayed there. And eventually it started getting a little bit bigger, and I came to the decision that I need to get this thing checked out. So I don't even have a doctor or anything. I never go to the doctor for anything at all. So I went to my local Med Express, which is like an emergency room type care place, and they took a look at it, and they determined that it was an infected hair follicle or something like that. So they gave me this cream to put on. It's sort of like a Neosporin. And I did that for the 2 weeks that they prescribed, and it didn't go away. In fact, it was just kind of just staying there and not only not going away, but getting a little bit bigger. So I made the decision I need to get this thing checked out by a dermatologist. And I called them, and unfortunately they couldn't get me in for like 2 months. So I finally had my appointment. This was back in July. They looked at it and they made the decision that it was basal-cell carcinoma, which is the most common form of skin cancer. The lady gave me a pamphlet on it, which I'll show you some information on it right now, and you can see if this is something that you're experiencing. Maybe this is what you have. Here's a pamphlet they gave me on basal-cell carcinoma. The most common skin cancer is the text line below it. And it goes over how common it is and how many people get it per year. Apparently it's about 2.8 million cases in the United States. And then the cause of it is exposure to sun, which is something that you can kind of prevent if you wear a hat or wear proper clothing outside. And then it talks about the risk factors, and then that it's not to be ignored, which I kind of did a little bit. And then the risk of reoccurrence, which I'm going to make sure I take precautions against this. And then it shows some cases of it here. And you can kind of see, I mean, that's kind of gruesome, but what this can turn into or what it looks like. I mean, there's some very simple causes. And I would say mine's most similar to that right there. I'm sorry about the glare. And then there's some really nasty stuff going on this page. The most important thing for me, and for this video for that matter, is the section on types of treatment. And I read this, but I'll give you the summary of what they told me at the dermatologist. They're basically going to numb the skin around where the cancer is, and then they're going to cut it out, and then they stitch that up, and then they send that out for analysis to make sure it's not a dangerous type of cancer. And the good news is that about 95% of the cases are cured completely. So I have high expectations that this is going to go really well. So today is the day that I go to get this basal cell carcinoma cut out, and I decided that I'm going to share this experience with you. I really debated on whether to make a video about this because I just don't know if it's something that I should be sharing, but I do want to share this for people that maybe have a similar thing to what's on my scalp right here, and maybe it will give you an idea of what to expect when you get diagnosed with this and the process. So this is going to be something that we experience together, and I think it's going to be something that I can make a positive out of something that's very negative. I made it to the dermatologist. I'll show you the building they're in. It's actually a really interesting building. This used to be the old hospital, but now it's just a bunch of medical suites inside here, and I think that building's really interesting architecturally. I guess that's enough stalling. I should probably get in there and get this taken care of. I'm not too nervous about it. I think it's going to be a pretty simple procedure for them, but anytime you go through something like this, it's kind of nerve-wracking a little bit. Well, as you can see, my surgery is done. It went a little worse than I expected. I'll tell you the whole story here. I went in, you know, sat, waited, went into the room. They shot me with some Novocaine right around that spot, numbed it up really well, and then I really couldn't feel anything. They apparently removed the cancer there, and then they went to stitch it up, and that is when things went bad. The last stitch, like he had to put one last stitch in it, and I was like, all right, no big deal. Well, that one was on the very edge, and it hurt like a mother, and it still does. I can feel it like pounding right now. And apparently when you cut into someone's scalp, I learned this today, it bleeds like crazy. So my head's like bleeding really bad, and they put this thing on. So when I left, everyone is like staring at me, and the lady's like, oh my God. And I was just like, all right, it's not as bad as it looks, but I have to wear this thing for the rest of the day. and then take that off. And apparently I can shower and everything's fine tomorrow, and then I just have to keep it clean and everything. I was hoping to be able to show you what it looked like with the stitches and everything, but I mean, this is what you can see. I haven't seen it yet, but maybe you can see it. That's what it looks like, and I have like a thing on my head, so I'm glad that's done. And I get the results back for the biopsy or whatever in a few days. They're going to FedEx that to Texas or something apparently. And then I come back in 8 to 10 days to get the stitches out. So that's my basal cell carcinoma story, and I guess it was good to share on here. Maybe you now you know what to expect if you're going through this. It's not fun, I can just tell you that, but I think everything's going to be okay. Got to wear a hat outside. That's the main rule of the story.